Hello there. Welcome to my podcast. My name is Brett Lovins. I'm sitting here reflecting on being sober on a weekend morning, not reaching over and looking. Well, first off, waking up in bed after deciding the night before to go to bed. These are small things, but they're a big deal for those of us in recovery. And just to paint a picture for you, I'm not hustling to get my phone to see who I may have called, who I may have texted with. I'm not running into the kitchen to assess how much alcohol is out on the counter and begin the process of trying to hide most of it so that it doesn't look as bad as it really is. I mean, this was my reality, and often I'll laugh, but at the time it's not funny at all. It's serious business while feeling sick, right? This was my reality, and now I get to wake up on a weekend morning and just sort of notice. And so I share that with you as sort of my preface for the podcast today. So I bring you a medical doctor. What a treat. An addiction specialist. Megan Tweedy introduced me to Dr. Zuckerman a while back, and we've been trying to connect to have a podcast for a bit, and we made it happen. And I'll let the conversation speak for itself, but how lucky are you, or am I, or anybody that's listening to this to get a chance to listen to somebody who is up close on the lines of addiction medicine. And, the word love shows up a few times, folks. Connection. So I hope you'll listen in, and I hope you'll share this with others as you think what might be useful to them. Hope your day is going great, and let's start the conversation. I can't tell you how awesome it is that you made time for this.
Oh gosh, I'm excited. Thank you for making time for me.
Oh, wonderful. So I've gotten sort of a cadence where I just sort of let my guest introduce themselves. Mm-hmm. So I'd love it if you would be willing to introduce yourself to the listening audience here.
Yeah, for sure. So my name is Gillian Zuckerman. I'm a family medicine doctor. I'm fellowship trained in obstetrics, actually. But my other great love that has gone throughout my personal life and my career is addiction medicine. That's a long story. We can go through that if you're interested, but I won't belabor that. I'm from Massachusetts, and then did my medical school out there at University of Massachusetts, and then out to Santa Rosa, California for my residency, that OB fellowship up in Spokane, Washington, and then out here to be one of the core faculty members at a family medicine residency in Yakima, Washington, called Central Washington Family Med, and also the medical director for our Suboxone prescribing clinic that we call Connect at that FQHC. So stay busy, do a lot of work in our local hospital system with consulting on opioid use disorder and other forms of addiction med. And it's a more than full-time job, which has been amazing. So.
Well, wonderful. And for those of you listening, my dear friend, Megan Tweedy introduced us. And if you're listening, Megan or anybody else, Megan and I have a couple of episodes on our podcast. So, and I'm originally from Yakima. So, and I've seen you present one time at the event that Megan put on in Yakima, which was outstanding. So I'm sitting here with a medical doctor. Would you say your specialty is in addiction medicine, or how does that,
yes,
how does that roll?
I would say so. It's an interesting world. Like I'm not a board certified addiction medicine doctor yet. I'll probably be sitting those boards next year. And I haven't done a fellowship in that, but I have had a fair amount of experience with treating in this arena. So.
Well, let's go there. So you day in and day out, you're dealing with this word patients, right? Mm-hmm. And so when I think about the disease model of addiction and addiction medicine, let's just give you a chance to speak to people with your vantage point on that and your understanding, or how you would explain that to somebody.
How to explain sort of addiction to people. Yeah. Gosh, it's so interesting, right? I think I'm grateful that we've moved to the disease model, to understanding this as a chronic, um, relapsing, although I don't love that language anymore, that terminology, but relapsing remitting disease is what we would call it, like sort of in the cold world of medicine. I think we have demonstrated a fair amount of biochemical evidence in the brain of differences between folks who struggle with addiction and folks who do not, whether they're in recovery or not, which is really interesting. And so I think that, how I try to explain this to people is I say, because I guess I often get the question, like, why don't people just stop, right? Like, that's how we usually like get into this. Why don't people just stop using? They made a choice to start, they can make a choice to stop. And that is the conversation I'm battling a lot. And what I like to talk with people about there is to say, okay, yeah, they may have made a choice to have that first, whatever it was, first drink, first bump, like whatever it was for them. Although there is some evidence that says that that choice may be mediated also, right? I mean, like, we're often working with folks who at baseline from birth, from pre-birth, have lower receptors for some of these hormones in the brain, some of these chemicals in the brain. And so they may have a stronger urge or stronger craving to sate that somehow. But even if we say that that first time is a choice, subsequently, what happens is folks, as they use increasingly frequently over time, receptors for those substances are actually down-regulated. The brain is always trying to get to homeostasis, right? Always trying to achieve balance. And so in its attempts to do that, folks will down-regulate those receptors. And what that experience is like, because those receptors are the same ones that regulate pain, like mitigation of pain. They regulate love and attachment to other people, including attachment to like even our parents, like that evolutionary bio like drive. So as those receptors get down regulated, folks need to find more ways of getting that substrate and getting activity at those receptors in order to just feel normal, right? And so I think that that's what I'm often talking about with medical professionals and with my patients is we often think that if somebody is using when they say that they haven't wanted to, or when their goal is abstinence, we often think that they're doing it so they can get high, so they can get that euphoria. And the sad thing is that for most of my patients, they're progressed enough in their disease that they're not using it for euphoria. They're just using to try to feel normal because the absence of that drug feels so terrible, that withdrawal sensation. So, there's definitely like a biochemical component to this that we can clearly identify, like functional MRIs, like there's good science to support that.
Okay, so my drug of choice, I think I let you know that I'm in recovery too.
Yeah.
So I'm listening through what you're saying and thinking about my own lived experience with this,
Yeah.
right? Um, I was also an opioid user as well. And we're probably going to sneak up on fentanyl here as we go along too,
Yes.
because I know that's an important topic to bring up into this kind of conversation. But um, when you talk about finding your way to normalcy and feeling normal, and particularly when you start to talk about the discomfort, like even for alcohol, it's very uncomfortable when those cravings are lit up. It's
Yeah.
awful.
Yeah.
It's suffering
Yeah.
until you satiate that and cool that off. And my understanding, this is a question, is like it's even more intense for opioid folks. Is that a fair assessment or statement?
It's a great question. And I would say it's probably pretty tough to answer. I think it's such like an individualized experience from one person to another, and our individual biochemical makeups are different. I've heard it said that actually one of the strongest craving producing substances is nicotine, which of course is legal. um, uh, Alcohol brings its own challenges of like medical safety, like physical safety to that withdrawal experience, of course, right? Like folks can have seizures and even more like delirium tremens and hallucinations and all kinds of things. So it's difficult to quantify the discomfort that comes with that from person to person, is what I would say.
Yeah. And so in your practice then, so you get somebody who comes to you. So at that point, they're one way or another, they've accepted that they may have a problem, right? Because
Yeah.
that for most of us, that was a huge thing. I like to joke around. That's like Gollum, protect the precious, you
Yeah,
know.
for sure. Yeah.
So you get somebody who shows up and sits with you for the first time, assuming that that's part of the treatment.
Mhm.
What do you say? What's the early things you want this person to come away with?
Yeah, for sure. So in that first visit, and again, I spend a lot of my time doing Suboxone prescribing, so opioid use disorder and working with that particular medication. But again, this applies to alcohol. It applies to when I'm, prescribing methadone for the first time for a patient in the hospital or things like that. I think the most important thing I want them to take away from that first visit is I don't care what happens that week. Like they could go out and use more of their substance than they ever have in their lives. I want them to come back next week. I want them to come back to me and I want them to know that I still love them. I still care about them, no matter what happens that week. Right. I think that, the most dangerous thing that I see folks in starting that initial early recovery path, the most dangerous thing I see is people feeling like they're obligated to achieve success, like whatever they're defining that as, um, like right away. And I'm like, this is a process. Like if you don't succeed in your goal this week, it's because I haven't provided the right tool to you. And so I probably say that like 2 or 3 times during the first visit. Like it's very important to me to know that, and for me that they know that. And then the other thing that I think is really important when we're seeing folks in this early recovery stage is knowing that it's a bumpy road to get started. Wanting people to have those harm reduction resources that I'm sure you guys have talked about in the past. And for me, that means that everybody leaves my office with a prescription for Narcan, no matter their stability, honestly, but like, especially in those early days, no matter their commitment, like I just want them to have it. Maybe they don't need it for themselves, like maybe they need it for somebody else. I want them to have Narcan. I also want them to understand the concept of never using alone. And so if they don't have somebody that they can reliably use with, then making sure that they have the Never Use Alone hotline, which of course I'm sure your listeners know is a hotline staffed fully by volunteers 24/7, where you can call if you are wanting to use something and cannot do so safely with another person, and they will stay on the line with you, and call 911 if you start to show signs of overdose, which is amazing. So making sure that people have that, making sure that people have access to safer smoking techniques, syringe exchange, those kind of things. And again, it's a tough conversation, right? Because I never want folks to feel like I'm not confident that they can achieve sobriety, because I am. But the risk of that small chance of not being abstinent in that first week or first couple of weeks, the risk is high. Like it's a scary thing every time fentanyl is used, which of course, as you said, we're going to get around to. Um, we're risking a life. And so I just want that person to come back to me. That's all that matters to me at the end of the day.
Well, let's take this opportunity, if you don't mind, to circle back to the original earlier in our conversation. So you've just shared that with me. That lands well with me. What what about the people that were introduced theoretically earlier that say, it's a choice, and so then the next thing that somebody would say is, well, then that's just a collection of enablement, I believe is the word that's often thrown around.
Harm
Um,
reduction and enablement. Yeah.
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 So tell me how you would talk to somebody who would bring that up with you.
Yeah, it's a big discussion in Yakima right now. I think politically we're starting to explore how we feel about harm reduction. And it's a tough thing. And I will tell you, it took me time as a physician to come around to this, right? Like I know the science behind this, I understand this, and it still takes time to wrap my brain around it and to feel comfortable saying the things that I do to people sometimes around harm reduction. And so a lot of people in Yakima have brought up this concept of like, is this enabling? Is having access to naloxone, for example, enabling? Um, the thing that I say to people is that this disease, the core fundamental nature of this disease is that that death is not a deterrent. Death, and like, just if you sit and pause and think about that sentence, death is not a deterrent, right? And so if death is not a deterrent, then preventing somebody from dying is not enabling. People's brains are so wired to needing to feel that comfort that they're getting. They are willing to risk anything, everything, their families, their lives, their jobs, all the way up to death. And so it's if somebody is not alive, they have no possibility of treatment. Um, and if and so anything that I can put into their hands to help them stay alive until I see them again, is really important to me. Yeah.
Yeah, I'll throw in something at this point in our chat. So there, I've been involved with AA for many years. Although I'm not like dyed in the wool AAers, I know that there are plenty. But there's a lot of sayings in there, and one of the sayings that I think fits appropriately here is "Don't leave a minute before the miracle happens," which is really a powerful
Yeah.
statement because what I think I just heard you say, and I'm just going to add something to it is these people are worth it. Like I think that shame and stigma in particular, there's a misunderstanding about who is using drugs and alcohol. And it's not like, at least in my mind, Jillian, I love your thoughts I really don't believe anybody's better than anybody else to begin with. But let's just say that if you have some thoughts around that, this kind of person is better than this kind of person or whatever, I think it's safe to say that everybody is susceptible to this,
Mhm.
regardless of your socioeconomic situation, your skin color, anything else. And so that person that you may have helped stay away from death, right? The ultimate checkout, that people like me, we do recover.
Yeah.
And so when we hear stories about people who were in dire straits and you get to see it, right? That maybe that temporary harm reduction set them up for that opportunity to be there when that miracle happens and become somebody in recovery. So that's a long-winded thing to say, but please tee off on any of that, Jillian.
No, I love it. I love several things that you say. Number one, people are worth it. And I believe that no matter what somebody does or does not do in the future, like whether we achieve abstinence or not, people are worth it. Right. And that's if you sit and you spend time with folks who are in recovery, who are not in recovery, who are in an active addiction, and you get to know them. It's certainly a lot easier when people are in recovery, right? Like that is an easier person to chat with and function with. And I get to see that. I get to see people go from that active state of addiction to that state where they're I have patients now who are like getting into an arena where they're speaking publicly and they're starting to like come forward and have these conversations. I mean, you're doing it, right? Like you're doing the thing. And what if we had lost you? Or like, what if we had lost, my patients who are now speaking up and helping other people? When it comes to my patients, like I know that many of them, before they enter my office for the first time, have used Narcan or have had Narcan used on them multiple times. I mean, we're talking like upwards of 10 times or more. And if any of those had failed, they wouldn't be in my office, and they wouldn't be able to do the things that they do. And, they would have been the dead father or the dead brother. I'm sure that Megan has spoken of her family. My father struggled with an opioid addiction. And, that's the other thing you mentioned is like, it affects everybody. My dad was an anesthesiologist. He was like very well respected, amazing patient advocate, fantastic father. And he had chronic pain, and he struggled with that, and continued to struggle with it until he had an overdose. Had fentanyl been around when he was alive, it would have happened a lot faster, unfortunately. But I think, that's been the blessing in disguise here, is as addiction has penetrated communities that, where there are like communities of physicians or communities of nurses, I think people are starting to understand this more. As we've had discussions at Yakima Memorial Hospital around a lot of the stuff that we're doing with addiction care, more and more people are coming forward and saying like, yes, my brother, my son, my uncle, is suffering or has died from fentanyl. And I think it's bridged that gap between us and them, because it's all us. It's all us.
Yeah. Yeah, boy, there's so much to this thread of our conversation right here.
I know.
I've become more in tune with statistics, which has been really helpful in my advocacy work at the company I work at. The stat that I recently came across is 2 out of 3 people is either addicted or around addiction.
Yeah. Yeah. There are few people that I can talk to that don't have a story. Whether they're comfortable sharing it or not is its own thing.
And here we are. So let's talk about that for a second, if you're up for it. So you've taken time out of your day, and I know I've seen you. I've seen you speak on a couple of occasions. I actually watched the city council meeting that you and Megan were on. It was great. It was awesome.
Yeah.
So I would use the word normalization.
Mm-hmm.
So this podcast is going to get heard by some people,
Mm-hmm.
right? And I figure if I'm in my story, I'm safe. It was not normal for me to hear these kinds of things, right? And in fact, if they would have been around, I would have probably found them secretly, because I didn't want anybody to know that part of me that was scared and suffering was starting to get curious about what to do about it.
Yeah.
But I think it's changing, Gillian. I think that this normalization and use the word penetration with the nurses and doctors as an example, I think it's real. I'm seeing evidence in my world as well, and I'm super thrilled about it, because there's no reason for people not to know sooner. And what they can do with it, I'm not sure. But the other thing is there's I think it's useful to see that there are people walking around like smiling and having fun that used to be not doing very well, and I'm one of them. So anyway, there's a lot too. So take anything.
I'm excited by that too, and I think that we've been doing a lot of work at our hospital locally to try to make this more approachable. And I at the end of the day, I think it falls on folks who have not struggled with addiction before to make the world more welcoming and inviting for folks who are struggling or have struggled with addiction. And so what we're working on, like I think number one, what we need to do, what we're responsible for, is educating ourselves as folks who have not like actively struggled with addiction personally. We need to spend time with folks who have struggled with addiction so that we can see what that looks like. It doesn't have to be this scary other, this like, idea in our mind from like, Law and Order of like what somebody struggling with addiction looks like. so spend time with folks, read, stories of people who are dealing with this. I huge props to the Goldendale Sentinel. They've been working on a series, cataloging, folks' experience with fentanyl and like why they do what they do, but just like hearing those stories, telling those stories is like so important to humanizing this. And then what we've got to work towards doing is messaging that that it's okay to talk about, that this is safe to talk about. I have a little badge on my lanyard that says like, you can talk to me about drugs, no shame, no stigma. People can't read it. It's too small. I need to get a bigger one. But it's a space, it's a place. And then, my vision is that like, we'll have, in the same way that we have, LGBTQ friendly stickers everywhere, that we can have, safe space to talk about substances everywhere. And it's just important for our patients to know, for like that community to know that we love you. Like, there are people who love you, and like, no matter what happens, we love you, and like, it's okay. But that's on us. That's something that we got to do. And I do think we're doing a better job. When it comes to seeing the change happen, it's definitely happening. I think a lot of the stigma in the medical field has come from a feeling of defeat. I think for a long time, there has been this incorrect assumption that we can't help. And that's really draining for a medical professional. That's really hard because like all of us are caretakers to some degree, right? And to fail at something, right? To fail at helping somebody achieve their goal, whether that's like lowering their blood pressure or help keeping them sober. That is something that's deeply damaging to some docs until they learn how to cope with that. And I think that what I'm seeing is that people are seeing evidence that number one, we can help. Number two, that there are multiple ways that we can help, right? So like normalizing that harm reduction conversation. I think that that's really started changing the game. I see medical professionals being more hopeful than I've seen them be before. I've seen them being more open, and above all, most importantly, kinder. And it's been a cool 6 months. I mean, that's where I'm seeing it in Yakima. It's been a really cool 6 months.
Wonderful. I'm going to say something here and see how you think about this. Addicted people aren't bad people. And so that was a hard one for me because I'd come to believe that I was a bad person, or this dirty little secret of becoming Gollum, is how I used to like to think about it, slowly but surely, was something that I was very ashamed of. And as it got worse, I got more isolated. And so I would love for you to, but here's the flip side of it. And then I'd love for you to talk about this. The hard part is for me and for probably many others, the lengths we go to protect the precious, to protect the addiction. Some of that is some awful behavior, right? To ourselves, to others, to family, et cetera. And so then you leave damage there for the people around the addict as well. But at the end of the day, this behavior, I believe, is driven by basically the part of our brain that is fight or flight. It's the oldest part of the brain that has been wired up weird. So what are your thoughts on any of that, Gillian?
Yeah, cool. Gosh, that's a good one. Okay, so I guess first thing that I would say there is like I would speak as a daughter of somebody who struggled with his addiction, and I saw elements of that, right? And I knew that he was ashamed of that. And after I lost him, for years, the only thing that I could think was like, gosh, I wish I had been a safe enough space for him to come and talk to me about this. And knowing, again, as a daughter, having experienced some of that, some of those bad things that addiction causes, none of it mattered to me at the end of the day. He was still my dad. And I still loved him deeply, and I still love him deeply. And one of my like regrets is just feeling like I never was able to help him understand that. That I loved him deeply. So if somebody is out there struggling and saying like, gosh, there's no way I can get past what I've done, I want to tell you from a family member's perspective, like, no, like, no, yes, you can. And we want you back. So that's the first thing I would say there. When we think about people being bad people, that terminology gets thrown around a lot. And it's very much based in this moral understanding of what addiction is, right? It's very much based in that choice model. Like, I know something bad happened the last time I drank, but I'm making a choice to drink again, right? And I would very much argue to somebody struggling with like what they have done when they've made those quote choices to drink or to use again after seeing bad things happen. That's your brain's wiring, right? Like that is choice in the situation is a very warped word, right? It's not the full picture. That being said, it's not that we can't come out of it. It's not that we don't have that strength and that ability to make choices that can help us. But if your actions have been driven by that tendency to go with that mode, like that's because of your brain. That is not having to do with you as a good person or you as a bad person. And I think, again, the thing that's really interesting, the more time I've spent with addiction, because I definitely came into this with that like NCIS understanding of what addiction was, right? Or like that plus my experience with my dad. And so I had this very strong sense that anybody who used substances was struggling with homelessness and was, maybe struggling with like mental health issues. But I've met more and more people who are like, no, I'm like a fully functional nurse, or I'm a fully functional XYZ. And it just hasn't impacted that part of my life yet. And so I think over time, the more that we see those stories, we come to understand that like, this is not a natural state of somebody's being. It's a weird wiring in the brain, and it's overcomable.
Yeah. Yep. And due to, again, shame and stigma, and I speak from first person, like I've been sober now 10 years, 7 months, and a couple of days.
Yeah.
Who's counting, right?
That's amazing.
It is amazing for somebody that could not be sober for 2 days, right? And yet, even for me, it's only been in the last year or so that I've gotten, there's this thing that's out there now called recovering out loud. I'm recovering out loud. I'm not ashamed of it anymore. And that's been a journey for me. And I'm not saying that other people who are in recovery have any obligation to do what doesn't feel right to them. But this much time in, that's where I'm at with it. And I'm hopeful that these kinds of conversations that we're having that, are hitting some eardrums right now, or not now, but in the future when they listen to it, will maybe consider that, one, this is my thought. It's not my fault that I was an addict. It's not. That's, there were a series of circumstances that came to bear on my life situation. And it came to a point where it got really bad for me.
Yeah.
Bad as some, not as good as others, but it was bad enough. And so that's what I like to say to people is, number one, it's not like people that come to me and, that I'm around, it's not my fault. It's not your fault. And somebody who relapses around me, I tell them, you're me.
Yeah.
The only thing that's different between you and me is that I've maintained keeping that first drink out of my face.
Yeah.
If I drink like you, if I take a drink, I'm going to go where you are now.
Yeah.
And so that's what I believe. Does that square with your medical mindset as well?
Yeah. Yeah, for sure. I think that, what I hear from that is like, the possibility of a return to use, which is like the language that I'm trying to use now, I find it a little bit less stigmatizing than relapse. But of course, like whatever language people choose to use for themselves is 100% okay. But the line between abstinence and a return to use is thin, right? Like, and the folks that I know who are in recovery are like, that is something I work at every day. I have to be conscious of. And it's funny because, when you spend a lot of time talking with folks about abstinence and recovery, it's the same type of work that folks who don't struggle with addiction need to do to be like well in their lives, right? Like to not go around with like a very negative mood and lots of resentments and just have that like really awful feeling. It's the same type of work, right? Like the 12 steps are good for everybody. I mean, like there's nobody who can't benefit from the 12 steps. But it's funny how when, and actually Gabor Mate goes into this really nicely. Gabor Mate is a family medicine physician up in Vancouver, Canada. He wrote In the Realm of Hungry Ghosts. Yes, amazing book, 12 out of 10. Everybody who hasn't read it needs to. It's like 500 pages. I'm really sorry for that, but it's great. But Dr. Mate talks a lot in that book about his addiction to buying CDs, which like when you first read the book, you kind of scoff at it. You're like, that's not the same. It's different. But it's not. It's trying to, at its core, addiction is trying to fill a void, trying to fill something inside with something external. And like whether that is gambling, fentanyl, sex, or buying CDs, it still can be damaging to yourself and to those around you. And programs like 12-step are applicable to all of it, which is really cool. So yeah, we tend to, when it's having to do with substances or other sort of socially unacceptable behaviors, we ostracize it. And then we end up with this nasty cycle of stigma and shame, which then perpetuate people not seeking treatment and getting help. Whereas people who buy too many CDs like can feel relatively comfortable about seeking help. Although Dr. Mate does talk about his own like internalized stigma around that too, which is interesting.
Yeah. Well, this brings up another really important point, I think. And you said it a minute ago when you were talking about your dad. You said, I wish he, would have felt safe to talk to me. I've come to believe over time that connection is a really important ingredient. And that word can mean a lot of different things to a lot of different people. And I'm certainly not advocating any particular thing. Mm-hmm. Other than being able to get that stuff out of my head and out into the air somewhere, mm-hmm. And have it be not immediately returned with shame and you're a bad person. And I've come to believe that that's part of, this concept of recovery. Gillian, I hated that word when I thought it was, I despised it, but it really is a great word. And it means so many things to me now. But part of my recovery and part of my program is I feel like it's important for me to keep putting on my lucky socks and being around other people like me.
Yeah. Yeah.
What have you found in your practice for advocating for that kind of, element of treatment?
Yeah. I have a little dog tag on my keychain. I don't know if you can see it, but it says, connection is the opposite of addiction. And it's funny because we often think that abstinence is the opposite of addiction. But it's not. It's having that connection with other people. And again, if you go into Realm of Hungry Ghosts, again, another plug for that book, Gabor Mate goes a little bit into like sort of how his theory that all of this kind of relates back to a loss of connection, sort of like early, like whether that's like in utero, even with high stress levels from mom, or in early childhood, some damage to that like sort of typical connection pattern. Connection's like one of my favorite words in the world, which is why it was so funny when I joined this program called Connect. And I don't think that they were quite as deep when they made that up as far as like thinking through that. But I think that connection is incredibly critical to recovery. And it can take, as you said, a million different modes. I think the one that's most accessible and easiest to get to in Yakima, of course, is 12-step. 12 steps, 12 meetings a day, I'm sure, or more in Yakima County. And, if you don't like one, you can get to a different one, or if one doesn't work with your schedule, that's easy. There's lots of other like mutual support alternatives to that, which is awesome. Smart Recovery, Life Ring, Wellbriety, just like so many other options along that front, which are great. I think that one-to-one individual counseling is another awesome option there. Psychologist or a substance use disorder professional who just has that ability to do that. I do have other patients who like maintain their recovery without like a formalized process there, and that's okay. That may look like their families being their support, and those like, recovered relationships being that connection that they form, or, folks who are just out in the community advocating and talking, and that being their form of recovery too. But yeah, I think at the end of the day, we're all looking for love. I mean, like at the end of the life is about finding love and connection. And I think addiction is some sort of crack in that pursuit. And so we got to keep seeking towards that goal.
Yeah. Oh, that's so well said. I'm gonna tell you something that's pretty cool. Like, I don't know if Megan's told you this, but my main thing right now is trying to advocate within corporate America, within the company that I work for. So I
Mm-hmm.
work for Cisco Systems. It's like
Mm-hmm.
100,000 employees. Today we launched our first day of a peer network inside of Cisco.
That's
I
amazing.
just started posting some notes and links, and our mental health director is going to do a talk on in the middle part of January for Dry January. So, this is to me, this isn't the most people that are in this world, like we really care. Like I'm not doing that because I'm a proud addict,
Right. Yeah,
necessarily.
no.
Although I am proud in some respects, that's not true. I'm very proud that I've was able to and have continued to maintain sobriety. But for most of us, our stories have this similarity that we don't have connection. We
Mm-hmm.
don't find that we can approach people and say, I am in trouble here, or I'm confused.
Mm-hmm.
And so wherever that can start, I think is really important. And I think corporate America and workplace can be a great catalyst for societal change. So
Yeah.
I'm pretty excited about that. And I do
Dude, I
believe,
think that's amazing.
yeah, yeah,
That's so cool. Yeah, when we think about connection, like my opportunity for that, I think all of our opportunity for that happens every day, right? Whether that's I'm that obnoxious person who walks down the street and just like compliments people on random things that like catch my eye, right? Like, oh my gosh, your dress is so pretty, or your hair looks amazing today. And it's not disingenuous. I'm just trying to be present. And then if there's something that I think is a lovely thing, like I think, saying it is important. And so I think we all have that opportunity to connect with each other. And then, as a professional, as a physician, I hesitate to say this, but like I'm a physician who will say that I love you to my patients. Like I'm like, I love you, and I want you to be here, and I want you to know that I care about you. Because and it's nothing creepy. It's not that, but it's an opportunity for people who don't necessarily feel that love and that connection with their own network to know that there's somebody who's there for them. And I think that's important. I think that's what like medicine is at its crux.
yeah. Yes, that's lovely. And that's wonderful you shared that. You know, I said a moment ago, I think connection is one of the elements. The other element in my recovery program that I think is crucial is that I can't forget. And I think that that's another thing that when we talk about somebody who in addiction circles, we say go back out. Basically
Mm.
try it again. Well, I've been sober for 3 months. I got this, right?
Yeah.
And they go back out, and if you have this thing, the results are terrible as a general rule.
Yeah.
So that's part of it too. Part of why I stay around circles where people have this same condition and can laugh at things like the amount of effort that goes into recycling to hide the recycling as an example and laugh about that when at the time it's not funny at all. It's tragically serious.
Yeah, for sure.
So connection, and I can't forget. What else would you say to the person who is in recovery and is attempting to, maintain that over time?
Good question. Kindness to yourself, self-forgiveness, I think is one of the hardest parts. I think that is part of the 12-step program, if I'm not mistaken. But just being able to, yeah, I find that folks who are in recovery or struggling with addiction are horribly hard on themselves, as a general rule. And from the outside, you're just like, dude, you're doing a great job. Like you're kicking butt and taking names. And because of that, like internalized shame stigma, they can't always see that. And I'm sure that kind of goes back to childhood, whatever. So I think that that's really important, is like that generosity with yourself. And from that springs, of course, generosity with other people. But really it's about being generous with yourself. Yeah, no, I think that, like, and the other thing I was going to say is, there is some utility in avoiding like old triggers, right? But I think that for me, that's like along the, like, don't forget realm, right? Like, and it's not to say that folks need to start over in a new city or anything like that. But, if you know that there was a place or a face that is like a clear trigger for you, it is about finding different connections that are not going to bring you down those same paths.
Yeah. Well, this has just been an awesome conversation. I'm trying to think if there's anything. Here's a question for you. We've talked about this kind of in a bunch of different ways, but flat out, what's the most misunderstood thing about substance use disorder? Which, for complete transparency, I finally gotten comfortable with that word when we talked about, like, I changed my language based on what from earlier on the relapse word. Substance use disorder is way easier for people to hear than alcoholic or alcoholism.
Yeah.
But anyway, that's it. What's the most misunderstood thing from somebody who's up close to it on the regular, day in and day out?
Yeah. There's so much. That's why I'm pausing.
Yeah.
I think one of the most damaging misconceptions is that it's untreatable. I think that that's the scariest one to me, because I think that at that's at the root of so much other, like, stigma and hurt that we do to people who struggle with addiction. And so it is manageable. It is treatable. Yeah, I think that that's a really big one. And I think probably the other one is this, like, the image of, like, who the addict is, like who that person is, who that person struggling with SUD is. And, like, I have, even, I guess, like, even with my father being like an anesthesiologist, being a prominent member of society, like, I still have the internalized image, and I still have to be thoughtful about how I work with that in the medical field, whether that means talking to everybody about use disorders rather than just talking to people who, like, fit that profile in some way, or like how we choose to do drug screening and all those kind of things. I think that those are probably the two biggest misconceptions that I can think of, that I see on a regular basis.
Well, I appreciate the work you do. I love it when I get to hear you speak, and what a treat to be able to talk to you directly for this period of time. And I'm hopeful that some people listening will gain some value. Any other parting words that you have for our conversation?
Just love and hope. I think that those are, like, the two most important things. If there's somebody who's listening, who's, like, right in the beginning of that journey, like, know that you are loved, know that there is, like, something on the other side. And just in the moments where you can't remember that, like, just keep saying it to yourself over and over again.
Thank you, Gillian. you're just a diamond, and Yakima is so lucky to have you there. And I'm so grateful for the work you're doing for the people that need to begin to find their way, just like I did, with that bit of curiosity or that bit of desperation or whatever it is that gets somebody to your door and begins a journey. And my journey is ongoing, and my journey is now including being an advocate and recovering out loud. And thank you for sharing your knowledge and your time with my listening audience. And I wish everybody all the best.